It's Jackie. I have been asked to do a brief in-service on nail and foot care for our residents here. So we're going to do two things. First, we're going to review the nail care policy, which is located on the intranet under resident client care, and you click on nail care. And that's what you're seeing in front of you right now. And so we're just going to go through. First point is that a routine assessment must be done by an LPN before a healthcare aide can do the nails. So on your care guide, you'd see this under hygiene and grooming, and it might say nail care done on bath days. That would be okay for you to go ahead and do that. If it says nail care done by healthcare professional, you don't do that. You don't trim their feet, trim their nails or anything. Also that a resident must have their own clippers and files to be used. So the purpose of nail care is to keep the nails clean and trim, support quality of life, enhance comfort and mobility, and support a thorough assessment of feet and hands. Before you start, you should take a look at their skin and nails, both fingers and toes, and take note of anything unusual at all and report those to the LPN before you start your nail care. You do need to perform hand hygiene before, during, and after the nail care procedure. And you will also have to wear PPE. So you'll have to wear gloves, and you may also need to be required to wear goggles. You're clipping nails, sometimes they go flying out. We don't want them hitting you in the eye. It also covers instruments that are not to be used. Blades, rasps, scalpels, probes, or scissors. You cannot use any of those. And nails are to be trimmed following the contour of the finger or the toe. Like I said, residents do need to have their own equipment. They cannot share them with others. And once you're done using them, you must wash with warm soapy water and rinse well and dry before storing. All right, so now what we're going to go on to is we're going to go on to the 7-minute Mosby's DVD, which talks about nail and foot care.
Check your state and facility policy to make sure you are permitted to perform this procedure. Before you begin, perform hand hygiene and follow any other instructions provided in the preparation section of this program. Before performing nail and foot care, observe the patient's toes, feet, and fingers.
Very good. Okay. What about your feet too? We'll work on both. Okay.
After ensuring the patient's privacy, put a disposable bath mat or towel under her feet. If she's not ambulatory, help her into a semi-Fowler's position in bed and place a waterproof pad and bath towel under her feet.
So don't get up while I'm gone because this will be slippery. All right.
Fill a wash basin and an emesis basin with warm water. Test the water temperature on your wrist and make sure that it's not too hot.
Okay, I have your nice warm water.
Place the emesis basin on towels on the overbed table in front of the patient.
These are for my hands and this is for my feet. That's
Place
correct.
the wash basin on the bath mat or towel and help the patient place her feet in it. Have her put her fingers in the emesis basin with her arms in a comfortable position. Allow the patient to test the water temperature. Explain that soaking takes 5 to 10 minutes. Omit soaking if the patient has just been bathed. Follow your facility's policy regarding nail and foot care for a patient with diabetes. Before leaving the patient, place the call light within her reach. After the patient's feet and fingers have soaked, put on gloves and begin fingernail care. Using a cuticle tool, gently clean under the fingernails of one hand while the other remains in the water. Use a paper towel to clean the cuticle tool after you clean each fingernail or as needed.
Doing okay? Yeah.
Repeat the process on the other hand. While providing care, observe the patient's hands and notify the charge nurse if you see any sores, open areas, bruises, blisters, discolored nails, or other abnormalities. When you've cleaned under all of the fingernails, dry the patient's fingers thoroughly.
Okay.
Unless contraindicated, trim her nails with nail clippers, cutting them straight across and even with the tops of the fingers.
Well, almost done with this nail clip.
Great.
You getting too tired?
No, I'm fine.
Okay.
If required in your facility, wear goggles when clipping nails.
Okay, we're gonna file these a little bit.
Yeah? Shape and smooth the nails using an emery board or nail file. Gently push back the cuticle with a cuticle tool. For an elderly patient, use a soft cuticle brush or nail brush around the cuticles. After completing fingernail care, continue with foot care. Remove one foot from the wash basin. Using a washcloth, scrub the calloused areas of the foot if necessary.
I'm gonna go ahead and clean under the nails there, please.
Gently clean under the toenails using a cuticle tool. Use a paper towel to clean the tool as needed. Dry that foot thoroughly and repeat this process on the opposite foot, paying particular attention to the area between the toes. Unless contraindicated, trim the toenails straight across. A podiatrist or foot doctor usually trims the toenails for patients who have diabetes, poor circulation, or thick or ingrown toenails, or are receiving blood thinners. When clipping the toenails, remember to wear goggles if required in your facility. Shape and smooth the nails with an emery board, but don't file the corners of the toenails. Care for the cuticles as you did for the patient's fingernails. Apply a thin coat of warm, unscented lotion or petroleum jelly to the patient's hands and feet, avoiding the areas between her toes. If necessary, wipe off any excess lotion with a towel. Notify the charge nurse if you see cracks or sores between the toes, sores, open areas, bruises, blisters, or other abnormalities on the feet, or discolored nails.
Okay, I want to talk to you a little bit about your shoes.
Okay.
You picked nice ones with good support.
Yeah.
You need to inspect them.
As part of your follow-up care, tell the patient to avoid tight socks or stockings, avoid crossing her legs, wear well-fitting shoes, and inspect her feet daily for foreign objects, open areas, and rough spots. Perform hand hygiene and report completion of the procedure and your observations to the charge nurse. See the follow-up section of this program for detailed information.